Poor child, having whooping cough is no fun at all. In fact, it's not pertussis. It's caused by a type of bacteria called Bordetella pertussis. And whooping cough is the reason for many unhappy families. On average, 24.1 million people have to face this whooping cough every year, making an unhappy family. The bacteria is transmitted through the air, meaning it could be from a cough or a sneeze by someone. So, why do we cough when we got a whooping cough? It is because once the bacteria enter your lungs, they release something called cytotoxin. The cytotoxins damages the lungs, making you difficult to breathe. So, in order to breathe, the body has to clear the airway by coughing. After 1 or 2 weeks, the symptoms can be runny nose, nasal congestion, red watery eyes, fever, cough, provoked vomiting, red blue face, extreme fatigue, thick mucus. As it got serious, you will have bruised, cracked ribs, abdominal hernias, broken vessels on skin. For infants, it is more dangerous. The infant may get pneumonia, slow breathing, dehydrations, weight loss, seizures, and brain damage. But you should not be worried, as there are specific vaccines for your age to prevent the disease. The side effects of the vaccines usually are soreness, mild fever, and headache. The second option is to take antibiotic. However, if you have allergies to medicine, you should not use antibiotic. Both options are ethical, as they respect the patient's decision about their health. They do not harm the patients. They promote patients' best interest. And if you like neither of these options, you can always best avoid the bacteria by wearing a mask to prevent inhaling it. And that is mostly all about whooping cough. Thank you for watching. Have a good day.